Sweden has one of the world's highest COVID-19 fatality rates and is far from achieving herd immunity as hoped, but its state epidemiologist, Anders Tegnell, continues to push back against accusations that Sweden has fumbled its pandemic response and that the country is at risk of a resurgence of the disease.
This isn't the first time Sweden has faced backlash because of its COVID-19 policies. Early on in the pandemic in March, more than 2,000 academics signed an open letter to demand tougher social distancing measures. Earlier this month, the Swedish government launched an inquiry into its pandemic response after reports emerged that half of the country's COVID-19 deaths were in nursing homes, despite a ban on visitors. "We never really calculated with a high death toll initially, I must say," Tegnell said in an interview with The Daily Show in May. "We calculated on more people being sick, but the death toll really came as a surprise to us."
With 5,230 deaths since the beginning of the pandemic among a population of 10 million, Sweden's 8.2% fatality rate is one of the highest in the world, according to data from Johns Hopkins University, and Sweden broke its record for the most new daily infections since the start of the pandemic this week with 1,610 on Wednesday. Unlike other European countries that issued widespread shelter-in-place orders, Sweden instead aimed to isolate and treat confirmed COVID-19 cases. While many businesses, gyms, restaurants, bars and schools remained open, evidence shows Swedes are largely chose to social distance on their own, even when not required by law. Despite this, COVID-19 deaths began to increase in April. Sweden is somewhat of an anomaly compared to its neighbors Denmark, Norway and Finland, which implemented strict lockdowns early on and combined have had fewer cases and deaths than Sweden. As the rest of the region begins to slowly reopen borders, Sweden has largely been left out, with Denmark only allowing Swedish residents to enter if they live in a region with 20 or fewer infections per 100,000 residents in a week, far lower than the 155 national rate per the WHO.
Full coverage and live updates on the coronavirus.